It is a great honor to be at the POEM Congress this year in Amman, beautiful Amman. And I think POEM is very representative of the progress that can be made when different groups, different countries, different centers band together to try to make significant inroads into treating pediatric cancer. As was said last night at the opening ceremony, we all believe that no child should die of cancer, wherever they live in the world. And it's a long road to make the disparities go away. But collaborative groups like POEM are, I think, the way that this can happen. The Congress today, I'm talking about advances in bone marrow transplant and cellular therapy. Bone marrow transplant and cellular therapy is a very exciting, a very novel field. So far in America and in Europe, it has been incredibly expensive. And one of the challenges, I think, of groups like this is to figure out how these therapies could be equitably given throughout the world, independent of cost. I chose today to focus on 3 advances. There's many, many that one could choose from. And I am talking about cytotoxic T cells to combat viral infections after transplant. I'm talking about the role of CAR T cells in AML. This therapy has been well described and is very effective in ALL, and it's cutting edge, trying to figure out how to use it in other leukemias as well. And finally, I'm talking about something that's on everybody's mind, which is gene therapy for the hemoglobinopathies. Unlike many diseases that gene therapy is used for, when you use gene therapy for sickle cell disease and thalassemia, those are incredibly common diseases globally, and the majority of the patients afflicted with these diseases live in the Middle East and Africa and not in Europe and the West. And there has been a long search for a safe, effective therapy to ameliorate the burden of these diseases. Gene therapy is a start in that direction, but currently the complicated way in which patients are collected and the therapy is delivered, as well as the enormous financial costs associated with gene therapy, have kept it from being broadly used. And I'm hoping that one of the outputs of this Congress this year and in the next years to come can be to think creatively about ways that we can make this more available worldwide. I've worked now for 15 years helping create a pediatric oncology fellowship program at 57357 in Cairo, the Children's Cancer Hospital. And so we have graduated over 40 fellows from this program. And the tips I have learned from working on this program is, as much as you can, have some research project, some academic exercise going on in the background, because that keeps you rejuvenated. You get to come to meetings and present, you get to write papers, you move the field forward, and it's really hard given how busy you all are and the volume of patients you see. But if you can find a mentor and be always working on some research idea, I think it will allow you to have a lifetime's career that continues being satisfying.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.